All right, we are live. Thanks for joining us today, everybody. If you are new, my name is Kima, and I am the founder of Attracting Extraordinary Love, with the goal and mission to help women find extraordinary love and stop settling for anything less. And today, this whole month, we're going to be talking about all things sex. So come over and join the group if you haven't already, if you're joining us somewhere else, and if you're joining us in the group, so glad you're here. And if you've been in the group for a while, you may recognize the space we have here. This is Dr. Brianne Fox, and she is going to be our guest today and talk to us on everything she knows as a pelvic health specialist. Did I say that right?
You did. Yes.
Okay, good. All right, well, tell us just a little bit about you, and then let's join in. Jump in.
Absolutely. So I am a doctor of physical therapy, and one of my specialties, one of the hats that I wear, and probably my first and most deep passion outside of the mind-body connection is sex and all things related to the pelvic area. And so a little bit about my journey into getting into that, because honestly, going into physical therapy school, I had no idea it even existed. I did not know that was a thing. I think kind of like everybody else, you know, it's like, you have orthopedics, you have pediatrics, you have geriatrics, you have these like certain sections within physical therapy that you just kind of assume you're going to go into one of those. And I had pelvic trauma early on in my 20s through a sexual assault, as well as being in a outside of the car motor vehicle accident in which I was basically smashed between two cars with my pelvis. So I'd had a lot of pelvic trauma and had a lot of issues, urinary incontinence, which came with like painful intercourse as well, and just a bunch of different things that I didn't even know there was help for. And so I got into physical therapy school thinking I was going to do orthopedics. It was something that I had been down that road with injuries with soccer and things like that. And so during our second year of physical therapy school, we had this class where we had a guest lecturer come in, and she started talking about the pelvic floor, and a lot of it was obstetrics and gynecology type stuff. And so she was talking about that and just more of like a very surfaced component. And I was like, wait, I need to know more. And I just dove in head first. So my entire third year during clinical affiliations, I just jumped in and I started taking the coursework because it wasn't part of our physical therapy curriculum. It was all from an institute outside of the RPT, specific RPT curriculum. And so during my third year affiliations, I traveled all over to take the coursework so that when I graduated, I would be able to just jump right into the pelvic component of things. So for the last decade, I have been working with clients on bowel, bladder, sexual function and enhancing that for them, clearing them of dysfunctions, whether they believe that they're normal or not. And then also just chronic pelvic pain, and that's men and women and even children. So it's really a deep passion of mine, because I believe that all of the things that I just mentioned, you don't have to live that way. And so I'm here to just really pour into you guys and give you more understanding around sex specifically. And, I think throughout our time that we're sexually active, we, based on our own journey and our own experiences, we start to have these ideas or these thoughts and impressions about what it should or shouldn't be. And that's not always the road that we have to go down. So I'm hoping to give you guys a little bit of education here today so that you can kind of look at it from a different perspective as well.
I love it. And I just to give like a plug for what you do, I don't think that I knew that was even a thing up until probably about 2 years ago. And then all of a sudden I've had so many clients with like, just bladder issues or urinary incontinence or kind of just that leaky stuff, right? And then slowly more and more patients have like learned that there are PTs that do this and been able to get help for that, and learning that, hey, it's not actually, doesn't have to be that way, right? Like moms just think that it's just that way. If you just jump on a trampoline after having kids, like you were just destined to pee your pants all the time,
right?
Or you sneeze, right? And like just learning so much about that's been awesome. That's not what we're talking about today, but totally giving a plug for it. I think it's
right. Yeah, because it's this misconception of, oh, well, you've had kids or you're aging, therefore you should leak, or your vaginal dryness comes with postmenopausal period, so that you just have to deal with it. Take this medicine and hopefully it helps. And it's more than just that. So yeah.
Cool.
So I'm happy to be here. Thank you guys for having me.
even more that I don't know about. Okay.
Yeah.
All right. So since we're talking about misconceptions, let's talk about the big O and let's just dive right in.
Cool.
So,
well, and actually, oh, sorry, go ahead.
Go ahead. Nope. Go ahead.
So what I wanted to start with is just more of the anatomy, because I think a lot of us it's because it's in the vaginal or penile region, we tend to stray away from any kind of conversation around it, especially earlier on in life. And then sometimes, as we get more comfortable as we age and having those conversations with girlfriends, but still not probably as much as we should, or at least not having that deeper knowledge of the anatomy in that area and how it works for us. So I want to start there. Did you have any specific questions on the orgasm specifically, or just want me to get into that as we go?
We'll just dive in as we go. Cool. And then you guys, I know there's a little note that pops up with StreamYard that says like, we can't read your comments. I can read your comments. I just can't see who it is. So if you guys have comments as we go, whether you're watching live or afterwards, just throw them in there and we'll kind of just address it as it comes up. But I'm turning it over. Like, tell us about our vaginas and vulvas.
Okay. I love it. So I did bring my pelvic model today, you guys. So I am going to give you just a little bit of an anatomy here. So I'm going to turn my camera down just so you can see the pelvis without me holding it way up high. Let's see. Can everybody see that? I think so. Outside of the. Okay. So here's the front. All right. So here's the pelvis. So here's the front. Okay, so we're getting into all of the red that you see are all pelvic floor muscles, and I'm going to get into specifics in a minute here. So as we kind of turn, and then if we look back at the front and then turn all the way around, this is the back side of the pelvis. Okay, so what I want to bring your attention to is some of the anatomy here. So pubic symphysis is just this cartilage here in the front. It just protects these bones from rubbing on each other. But just, let's see, I'm backwards here. So just underneath that, when we get into all of the red through here, so this is layer 1 of the pelvic floor, and we actually have 3 layers. And really, in somebody who's very aware of those muscles, we should be able to contract all 3 individually as well as a unit. But for the most part, we talk about the pelvic floor as like a unit. And so I don't want you to think like, oh my gosh, I have to be able to contract all 3. That's something that like we would specifically do in the clinic to really just make sure that you have, especially if you're having leaking or something like that, that you really have the engagement of all 3 so that you're getting completion of that contraction and relaxation. But for general purposes today, so layer 1 is here on this outside. So if you didn't have any underwear on, you'd be able to see and touch layer 1 in all reality. Okay, so as I come in closer here, this yellow right here is your clitoris. Okay, and one of the misconceptions is that this is the clitoris, and that's actually false. So this is just the the tip of the iceberg, if you will. So I'm going to turn it here, and so if we're looking at, that's the yellow piece, the body of the clitoris comes back through here. And then it actually has legs that come down into kind of where we think of like the labial region. And that is, so the clitoris is 16 millimeters in size and about 7,000 nerve endings. So I always say, like, if you're sexually engaged and you're literally just focusing on this little yellow dot, if you will, that would be like you coming in for a massage and me massaging your knee and then being like, okay, how did that feel? Like, have a great day, right? So we don't want to miss the fact that there is so much more to the clitoris. And the clitoris is ultimately, that's like our sensory guy, right? So we want to make sure that we are getting all 7,000 nerve endings, if you want to think of it in that light, versus just the tip of the iceberg. That's going to take a lot longer for us to really be pleasured to a point of orgasm. And so when we talk about the orgasm too, this layer 1 of the pelvic floor, you can see how these muscles come up over. That creates the clitoral hood. So these muscles, as they're contracting and relaxing during arousal and during intercourse, are going to help to sensitize that clitoris by moving along the top here and creating sensory. And then the G spot, as we talk about, that would be like us coming into the vaginal opening and then up underneath into that underneath side of the clitoris there, and working through that sensory component there. So we really want to make sure, and whether it's like massaging throughout, making sure you're not just focused on the tip of the clitoris, but really engaging all of this sensory. Like, it is a magical tool. And, you know, if I had to slap a number on it, probably 90% of us, until we know, we just don't know. And so I really encourage you to, and even if it's like you're going home to your spouse or your partner or the person you're intimate with right now, and you are like, hey, did you know? Like, I had no idea this is a thing. And you just talk about it in that way of learning, then they're like, oh, like, I didn't know that either, but I'm not willing to admit it, right? And so you don't really necessarily have to be like, hey, you're doing this wrong, but like we can really emphasize being able to sensitize all of the sensory components to really enhance that orgasm. Okay, so now let's come back to the floor. So your urethral meatus right here. Okay, that's where the pee comes from, and then vaginal opening, and then anus here. Okay, so you guys can kind of see how that comes around like that. And then layer 2 is just underneath layer 1, and it runs more in this angle here, and that's going to help control sphincter control for like incontinence or anything like that. And then layer 3 is really deep. So layer 3, we're getting like deep inside the pelvis, so we're coming all around here, creating stability and support. But then you'll also see as we come back, we're getting into connection at the tailbone as well as up through the sacrum. Okay, and it's on the other side, but you can see that. And then here's the anus where our feces exits. And so these muscles come all the way around. So those of us who have incontinence, a lot of times that's where that pelvic floor piece comes in, is that when that pelvic floor is tight and it's not relaxing while you're on the toilet, it's really difficult to defecate and get rid of that feces. So, but where the pelvic floor comes in super handy for the orgasm is that a maximal contraction of the pelvic floor is ultimately what gives you that sensory and then that climax. And so the stronger we are, typically the more pleasurable and the more heightened that orgasm is. So it's important to look at all components in a sense of sensory. So where does sensory come from? It comes from our spine. It comes from the nerves that are innervating, as well as that muscle's ability to contract and relax. That strength comes from nerves as well. So when we're looking from like a clinical side, we want to make sure your spine is nice and supple and stable and that your nerves are signaling out as they should. But we also want to make sure from a functional standpoint that all of your muscles are working well and that you are able to contract and relax to really start to build up. Okay, so here's the thing though. Let's talk orgasm for a second because we're kind of at a disadvantage. I'm not going to lie, ladies. So typically for us, it's about 18 to 25 minutes for us to self-lubricate to a point where that orgasm we're at that maximal contraction, we're having that buildup, things are flowing, we're moving, and we're excited, right? And,
okay, so
and then it's like
question.
Yeah.
So like 18 to 20 minutes, because you just like blew my mind a little bit. So like 18 to 20 minutes, like are we talking from like the start of like kissing, the start of touching, like penis in the vagina? Like what are we talking about for 20 minutes here?
So yeah. And so that's the thing is, right? Like, so let me just give the male statistic and then we'll kind of go into that. Okay. So men are 6 to 8 minutes typically. So if you just think of that from a, like, we start here and let's just assume quickie versus like sensual, long, drawn out foreplay and all of that goodness, right? But like, we're just going to do this thing. He's like 6 to 8 minutes doing the quickie is like super sufficient and that's fine for him. But for us, we're at a different page. So we need a little bit longer of that buildup to really self-lubricate and to get ourselves into a position where we're, I'll say, prepared or ready. So in that, when we really think about like the foreplay component, and that foreplay doesn't necessarily have to be around the vagina. Okay, so foreplay could be you're in the kitchen and he comes up behind you and kisses you on the neck, or your partner comes up and starts talking to you about what they're expecting to happen that evening, right? So like just getting into that mindset, our mind is a powerful thing, right? And so getting into that mindset of like, whoa, like this is happening, like that's exciting, like I'm feeling some movement down in that space. All of that really is part of that foreplay component. You don't have to be naked, laying in bed, that sort of thing, right? But taking that time to really build up. And typically as women, because we are usually more emotional beings, if we start to, what I see a lot is if like he's already there and we're not on that same page, then we start to get in our own head about like, oh my gosh, it's taking too long, or does it smell or feel or look a certain way, right? And so we're just like, la, 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 la. Yeah. And instead of just really understanding that our bodies work differently and then just honoring that component of it. Yeah.
Yeah, because okay, so you did not blow my mind with 6 to 8 minutes.
It's probably more like 2 or 3, let's be honest, but yes.
That doesn't surprise me at all. But yeah, that difference. So if like I think about like just doing math real quick, like it can take like 3 times as long really for a woman to get there than a man on average, right? And so how much time are you spending around the prep work to warm up, around lubrication and all of that? Because like how important is like self lubrication around like a woman being able to orgasm?
Yeah, and it is. I mean, if we think of just friction, right? Like you think of chafing, you think of friction on anything, like it doesn't feel good. And so, and then we get into other components like positioning of your organs. Have you had children? How are things, where do they sit inside of your body at this point? And positions. So, a man's penis naturally will angle up. So if you're in like a doggy style position versus missionary position, totally different where the tip of his penis is hitting. And so for some people, they find discomfort in certain positions based on just anatomy, angle of his penis, size of his penis, and all of those things. But if we just think simply of like friction without the lubrication, whether it be self lubrication or added lubrication, it's really important to have a little bit of slickness and slipperiness in there to decrease the friction that can ultimately cause like a protective response or, like a chafing or an irritation in that, because body doesn't like that. And we're going to go into this protective response if something's feeling uncomfortable. Mm-hmm.
Yeah, I'm literally like envisioning my like thighs without like in a dress right now.
Totally. That's why I hate wearing a dress. Yes, totally. Like everybody, yes. So, understanding those things of like, hey, it takes me a little bit longer. And, or if we want this to be fast, maybe I bring in a little lubrication from the outside world into this. There's nothing wrong with that. But it's understanding the why behind it. And then also having a partner who's willing to understand that and take the time, if you will, to just really encourage that syncness within, if you're wanting to have an orgasm around the same time, well, then it's a give and a take, understanding that he's going to be a little bit quicker. Maybe a little more time is spent on the female initially, right? Or at different pieces in that sexual intimacy at that time. Mm-hmm.
Okay, life-changing. Yeah. Good stuff. Okay, all right. So that's the anatomy of an orgasm. Ladies, let me know if you have any questions like as we go, like as we're talking about orgasms and those kinds of things. You kind of shared with us a little bit about, us versus them and how long it takes. And then I think, another common question that comes up around this is like pain during sex. Mm-hmm. You already talked a little bit about positioning. Is there other like types of pain? Like what would be like a normal versus not normal pain?
Yeah, well, any pain is not normal first and foremost. So any kind of discomfort really that create it. So, well, let me go back. So anytime we have a discomfort that lasts more than just like, ooh, that was weird, right? But something that's irritating or uncomfortable or even painful, in our systems, our body's going to create this a snapshot of what that feels like, whether it be that you're wanting to be with that person, or if it's in a situation where you haven't chosen to be with that person, the body's going to create a snapshot around that in a chemical reaction. And the pelvic floor and our upper traps are two muscle units in our body that are just phenomenal for protecting. However, if they don't know when to turn off that protection, that can become an issue. So when we look at inflammation, trauma, repetitive emotion around sexual engagement, all of those things can create muscles that go into this reflexogenic protective mode. And ultimately, they're not going to have the contraction and relaxation. They're just going to stay in this high tone spasmodic state. And that's ultimately what's going to cause pain from a muscle standpoint. But it's so in that we want to really work from a mind-body connection to say, okay, where does this stem from? And how do we teach these muscles to be able to do both? Contract, because we want that contraction for that orgasm, but we also need to be able to relax and have that balance of both versus staying here. We want to be able to come down and come up and come down and come up to really build, right? The other thing would be positioning. So kind of, we talked about that a little bit, is just anatomy. So if you are, let's just assume, on hands and knees in a doggy style type position, and he's entering and his penis is long enough or large enough with the curl that it's hitting something, from an anatomical standpoint, that can be pretty uncomfortable. So changing positions, if that takes away that discomfort, awesome. The other thing I see with some folks is that the spine is really important. And so if you're in like that doggy style position and you're super arched in your lower back, you might have some discomfort. But what if you kind of neutralize that spine? That might change it. So sometimes it's just literally like a fine tuning. If you really like that position, it's something the two of you want, then maybe it's a fine tuning. If you don't really care about the position, maybe it's ultimately changing the whole position altogether. But if pain is something that comes on a regular basis that then cascades into a lot more, and it is never normal, it's unfortunately very common, and it's unfortunately very common postpartum as well, because we have a lot of anatomy changes and a lot of trauma that happens during carrying a fetus then, as well as the delivery process. And so we see a lot of, there's high statistics on moms postpartum in that first 3 months that just experience a lot of tissue discomfort with intercourse. And then if we continue to push through it, it's not a no pain, no gain kind of thing. If we continue to push through it, it's tattooing that, that snapshot, if you will, and then that cascades into more. And then everybody, right? We're sexual beings. So if we're having pain with intercourse and it's affecting our pleasure, it's affecting his or her desire to, they don't want to hurt you ultimately, right? So if you're with somebody who sees or knows that you're having pain with intercourse, they're not going to want to initiate. And so then it becomes this tension between the two people. And I see that just really go down the wrong rabbit hole. So we really just want to make sure that your tissue is able to handle it, your spine is able to handle it, your emotions are able to handle it, and that we really work with the whole person to ensure that, gosh, you can have the best sex life you want, right? It's super important.
Okay, so let's talk briefly about like how that ties in emotional health. We're going to talk a lot about sex and emotional health this month, but like you're talking about how emotional health can then turn into physical pain, right? Especially around that snapshot. Yeah. So one of the questions I asked in the group this week was, have you ever like felt obligated to have sex and like basically like pushing through even though you didn't really want to, like not in a trauma way, not, we're not talking about trauma at this point, but like really just that idea of like, maybe I'm not that into it, but he is, or I think that I need to, or like those kinds of things. Like, how do you see that showing up in your practice?
I actually see it show up a lot. And religion is another piece of that. Those who have been brought up in a certain religion often have a certain impression of when they should or shouldn't have intercourse, or even self-pleasuring. So that becomes a whole nother thing. But I think the biggest thing is when you push through it or you feel obligated. If you haven't had any prior trauma, once or twice, you might be okay. But what happens a lot of times is when we're not emotionally into it, or when we aren't able to have an orgasm, we can, and we have a higher risk of pelvic inflammation, because we basically, during that arousal and during that engagement part, we're bringing in all of this flow, blood flow, lymph, all of this fluid. And then if we don't actually have the orgasm, which a lot of times happens if we're not totally into it, or we're feeling obligated, or we just want to pleasure the spouse and be done with it, or we have a spouse that doesn't take the time or doesn't understand the importance of the orgasm, that can lead to pelvic inflammation. Pelvic inflammation shuts down the muscles. It creates this inflammatory response, and that ultimately can lead to pain if there wasn't already pain. And I actually would love to do a study on young women who are having sex that just don't know any different. And so, it's this like high school or college, and it's just being sexually active is like the thing they want, but they don't understand the importance of completion, if you will, and how that kind of sets us up. If we're in that boat, it sets us up for increased pelvic pain, poor sexual experiences, and things like that. So we can really go down that hole of like, this isn't something that I wanted. It's not pleasurable. I didn't complete the act, and my body is responding as a result of that, which creates that snapshot.
Okay, so how like what, I mean, you're talking about like the importance of having an orgasm, but I think like in my circle of friends, I think the conversation is like, a lot of times I'm just not going to get there. Like I'm enjoying sex, whatever. I'm just not going to get there. Like how often should women be orgasming?
Every time.
Every
And
time?
yeah, I mean, really, like once in a while, and it's, you know, like, I don't know, the baby starts to cry, or, you know, someone rings the doorbell and you haven't completed, like that's more than likely not going to be an issue. But if it's a repetitive thing, if it's, you know, more than, I'll say 20, and I don't even know, I don't want to put a number on it, but let's just say it happens frequently, that's going to potentially, it's put you at a higher risk to lead into some dysfunction and, improper use of the muscles, improper use of the, I mean, think about it. If every time you do something, so, you know, I have a lot of clients who they do it out of wife obligations, but they never have, they don't really know what an orgasm is. I've had people who are in their like 65 and are unsure if they've ever had an orgasm. So even if they started being sexually active at 25, that's 40 years worth of sexual intercourse without an orgasm. Like think of the you know, the leaves in the drain and the pelvic response to that. And without pleasure, typically if something is pleasurable, we want to do more of it, right? And if it's not very pleasurable, then we're kind of like, I don't really need it, right? Like I don't like sour food. I like chocolate. If you give me chocolate, I'm going to want more chocolate. You give me a taste of that sour food, I'm like, you know, I could do without that, and that's fine. So then what does that turn into as far as a relationship, right? As far as this person seems to be pleased every time we're done, but I'm not. Mm-hmm. And then how do I ask for that? And then do I have a voice? And if I try to have a voice, do they listen? Do we even really know anatomically what needs to be happening here? So it really goes into a lot of other things as far as just being open and being able to communicate with your partner, your spouse, so that you can enjoy it and your body responds in that positive way to that act, right?
Okay, well, you guys just let me know in the comments that I am not alone, that I did not know you're supposed to orgasm like most of the, like every time. Like that's brand new information for me.
For most, yeah, for most. And that's kind of where we go back to where like, come on, when have you ever really sat down and talked about this, right? And so you don't know what you don't know. And so just even clients that come in that maybe aren't having sexual dysfunction, but are having bowel and bladder stuff, like we have these conversations because it's important for us as human beings who are sexual beings to know and understand these things so that we can really embrace that part of our human selves, right?
Yeah. Okay, good. So any advice for women? So let's say they're not having orgasms every time, like obviously you're supposed to. And maybe they and their partner haven't really figured out how to communicate about sex yet, or they haven't quite figured it out yet. Do you have any advice for like how they should kind of handle that?
I do. And I think, you know, of course it can be very individualized, but I'm going to kind of just give some little toots so that you can take what you need from it. But I think the first thing is can you have that conversation with your significant other? Is that something that the two of you have ever talked about? And if not, is that person willing? Because I think sometimes we retract back because we don't think they are. But that's why using even like this podcast and saying like, oh my gosh, I learned this today, and just see how they respond to that. Like, I learned this about the clitoris, and here's the thing, right? And so seeing how open they are, because it's important that you both are able to have that conversation and they hear you, right? But also too, understanding how the anatomy works. And if you're able to self-pleasure, let's say you've finished intercourse, your person is not respectful or responsive to this component of it, and you've completed it and they're gone, they're out of the room, like, girl, like if you need to go take care of yourself, do that, because the health importance is there. It's super important that we complete the act, and it doesn't necessarily have to be like in the moment. If you can go, you know, a little bit later and complete it, that's awesome. If that is not your thing, self-pleasuring is not a place you go down, that's okay. See if you can have those conversations with your significant other. And then the other thing would be is coming back to understanding the why. So does it come back to like earlier in your sexual experiences? Does it come back to that person not being open and receptive to having those conversations? Or does it come back to a fear that you have? I have a gal right now who has this fear of how she might smell or that she might toot during intercourse. And so as a result of that, she carries this like stress within it, and it really makes it hard for her to relax and let go and allow for that contraction relaxation, which we need that whole movement of that muscle in order to build up. And so she holds this tension pattern, which ultimately over time doesn't allow her to have the intercourse because it's just this holding pattern. So really tapping into the why, like what is the block for you? Is it commitment? Is it you believe you shouldn't feel pleasure, that you're not worthy of that? Like there's so many other things we can go down. So I think the takeaways for that to kind of summarize is see if your significant other is receptive and responsive to conversation and learning. And there's a great book called She Comes First. And that book has awesome anatomy. So even reading it and sharing like, oh my gosh, I was reading this book and here's, you know, what I learned or whatever. And just seeing if you can really start to get on the same page with that. And then just understanding too, that you may take a little longer. And if you've had a hard day and your day has been emotional and stressful, you may take even a little longer, but you have to be able to understand where you're coming from, how our bodies work, the mind-body connection, and being able to just really be in that moment of the intimacy and allowing yourself to feel pleasure.
All right, ladies, you heard it here first. It is critical to your health that you have orgasms.
Yes.
And what I'm hearing Dr. Fox say is really this idea that like, not just focusing on the physical, but looking at that emotional piece too, right? So I know there's some women that are listening, and I'll ask your advice on this too, that maybe have never even had experienced an orgasm, because that's not that uncommon. And looking at like, yes, we need to learn about the physiology about that and what's going on there, but like what is going on for you emotionally and mentally, and how much pressure are you putting on that, and what are the expectations you're putting around that, and what's your history around sex or your beliefs around it, or you know, one thing you and I talked about when we were having coffee talking about this is this idea of even giving yourself permission for pleasure. Like it's not just about satisfying him. It's okay for you to have pleasure. Your body is built this way. And what Dr. Fox is saying right now is that like, it's actually really important for you to experience that, not just because it's like this dirty, shameful thing, but it's actually a really healthy part of your anatomy.
Yeah, it's so true. And when we think of it in that way, right? Again, we go back to that chocolate Sour Patch analogy. If your spouse understands that when you both are on the same page and it's pleasurable for both, he or she is wanting it, right? But they're being pleasured. If you're not being pleasured, your desire for it changes. So if you can get on the same page and each time there's that pleasure component, you're going to naturally want it more.
So many good nuggets. Okay. Do you have like, what else do you have for us? What do you have any other nuggets of wisdom that we can wrap in here?
Yeah.
No pressure.
No pressure. Oh my gosh. I think the biggest thing is just really being able to understand that sex is a beautiful part of who we are. And we haven't always been told that. We haven't always experienced that. But even if you haven't, realizing that it's a thing and that it should be a wonderful experience between two people, and intimacy as well. And intimacy doesn't mean sex. Okay. So even if you're not able to have sex, intimacy is a huge part of how we are and how we can really be on the same page and just fulfilled within our relationships. So just remember that I do give you full permission to want to have better sex, to want to have an orgasm, and to continue to pursue that for yourself.
I love it. Okay. Any other questions, you guys? Go ahead and just post them in the comments and we'll try and address them before we get off here. And if you're watching the replay, just post your comments after the fact and I'll check in on them, and Dr. Fox will check in on them, and we can kind of come back to it. But I love this. I love the anatomy lesson. Like I learned some new things there. I don't think, I mean, it makes sense, especially having had some clients with pelvic pain, how interconnected that whole system is versus like, we just think of pelvis. I don't know. I think of Kegels. This is like what comes out. Like you need pelvic health. You need to do your Kegels. Like that's it. How important
and I'll be
are
honest,
Kegels over here?
Kegels are maybe 2% of the population I see. So that's a misconception. We can always talk about that later. But a lot of times it's believed like, oh, you have something pelvic wrong, that Kegels are the go-to. And I promise you that they aren't the go-to. Now, if you don't have any pelvic pain at all and no other issues in the pelvic region, which you may or may not know what that is, and you may need to see somebody, then maybe it is a weakness and you need Kegels to help strengthen, and that could be. But at the end of the day, like I said, like 2% of my population that really fits that bill. Usually there's much more. There's the emotional part, there's the system part of like pressure changes and postpartum and all those things. So Kegels are not the answer. If you are trying Kegels and you're not getting better, then definitely see somebody.
Okay. What about, you talked about like the muscles, like being able to contract and have strength in the muscles is important for like the better orgasm. Is Kegels the way to kind of go about that? Or is there something else we should be focusing on?
Yeah. So in our initial minds, we think like, oh yes, like the stronger I am, the stronger that contraction, right? But what I really want to emphasize today is that yes, we need that strength in the contraction, but we also need the relaxation and then the strength and the relaxation. We need that mobility of the tissue. Whereas if we're just here and we're here and we're here and we're here, that's going to create more of that spasmodic reflexogenic protecting and create pain. So we really want to ensure that we have length of the tissue so that your pelvic floor can relax in order to pee and poop properly, but also as part of that buildup. And I think that's what happens for a lot of women too, is we're building up, rather than like during intercourse, we're allowing ourselves to breathe and just be in it and enjoy and receive pleasure and then build up and receive and then build up, right? And so really almost like a swing set, like we're working on both ends versus like just swinging over here. So yeah, the muscles are super important as well, but we really want full mobility of them, not just the strength component.
Yeah, cool. All right. Well, thank you so much today. This was so good. I can't wait to like hear more about. Ladies, let me know your thoughts down below in the comments because I'm super curious about this. We're going to keep this conversation going.
Cool. I love it. I can talk all day.
We've got one more question that just came in. What about value of romance aids or toys? Can they help?
100%. 100% they can help. There's nothing wrong with using external devices or other things, visual or tactile. The one thing I would caution you against is I've seen it a lot where women who are single are using one specific toy every single time, and they get used to that vibrational component. And so their nerves get very familiarized with it. And then it is super difficult to have an orgasm outside of that toy or that tool. So it's really important that if you are, even if you're alone or with somebody, that you really just try to use multiple facets of different things so that your body can just be used to mechanically doing what it's supposed to do, no matter what tool or person or finger or penis or whatever it is that you're using. Yeah.
Okay. I have heard that about vibration, like around like it overstimulating the clitoris and that piece of it.
Yeah. So I think what happens there is we get focused on that little yellow bulb, that tip, right? Or one spot, and then we get harder and harder and harder. And that's just not comfortable. We really want to ensure we're sensually, in a sense, I'll use that word, like working the entirety of so like I said, just like you go in for a massage, they're not going to like rub your head and send you on your way. They're going to massage your entire body. We really want to make sure that we're working and massaging and sensitizing the entire clitoris, not just the little tip.
Gotta get in there and like explore. I love it.
Yeah.
Lots of variety. Latanya says, yay, variety.
I love it.
All right. Awesome. Thank you so much for joining us today. We'll talk to you again soon.
Okay. Sounds good. Thanks, guys.